Over the last 20-30 years, there's been a long debate about the role of radiotherapy for the treatment of patients with diffuse large B-cell lymphoma. Starting in the pre-rituximab era, radiotherapy was recommended as part of a combination treatment or as a consolidation for those patients who had bulky disease or extranodal disease when the disease was diagnosed. Actually, since rituximab was available and immunochemotherapy became the standard, important data were accumulated also coming from randomized trial, suggesting that radiotherapy was no more needed in patients with limited stage disease without bulky or extranodal sites. So the question remains whether it is needed and it can be helpful in patients with bulky or extranodal disease. And based on what we currently know, we don't have results of phase 3 randomized trials yet, but we should say that in standard practice, there is no evidence today to safely skip radiotherapy in this patient. I mean patients with bulky disease or with extranodal sites of the disease. This recommendation comes from the preliminary result of the German Unfolder study that was initially designed also including a randomization of radiotherapy versus observation in patients that were specifically IPI-1 or had bulky disease. So at the interim analysis, this trial recommended that radiotherapy could not be avoided in this subset of patients, and the trial was amended to recommend that all patients received radiotherapy. But now things are changed again, and the main change is represented by the use of metabolic assessment of response. The prognostic role of a complete metabolic response is very clear and is highly predictive for the best outcome for our patient. So there is a more than a rationale to consider that patients who achieve a complete metabolic response are not candidates to being treated with the radiotherapy because the added benefit of radiotherapy could not be seen. At the current time, we don't have phase 3 randomized data, but we have non-randomized data, again from German studies, that suggest that if a patient achieves a complete metabolic response, also if he has a bulky disease or extranodal site of disease when he is diagnosed with diffuse large B-cell lymphoma, then there is no clear role for radiotherapy. So the role of radiotherapy in the era of chemoimmunotherapy and of metabolic assessment of response using PET still remains, but it can be probably limited to patients with a partial metabolic response at the end of therapy. And discussing radiotherapy in diffuse large B-cell lymphoma, some words should be spent regarding the treatment of primary mediastinal B-cell lymphoma. There is a subset of diffuse large B-cell lymphoma that typically affects young patients. So discussing about the role of radiotherapy in this particular setting of patients is particularly important because it's very important to try to avoid the late effects of treatment, and we know that radiotherapy can have an impact on the long-term outcome of the patient. In the treatment of primary mediastinal B-cell lymphoma, radiotherapy has been recommended quite strongly as part of a combined modality treatment if chemoimmunotherapy was R-CHOP or standard chemoimmunotherapy. We now, however, have initial evidence that probably some patients can skip radiotherapy. There are encouraging data showing that if we choose a different regimen than CHOP, that is dose-adjusted EPOCH plus rituximab, probably radiotherapy is not needed. This comes from a large monocentric phase 2 study conducted by the NCI. And most important, we now have an ongoing randomized trial led by the ILSG, that is the International External Study Group, that is designed as a global study that involves several countries in the world, that basically is designed to try to assess if in patients achieving a complete metabolic response after standard immunochemotherapy, radiotherapy is really needed. So this is a non-inferiority randomized phase 3 study that at the end will provide us a definite answer on which is the role of radiotherapy? And the answer that this trial will provide us is very important because, again, patients with mediastinal B-cell lymphoma are young, and in the decision of how to treat this patient, a careful assessment of the risk, also long-term risk, should be performed in every single patient.